Seniors, this could save your life. 4 medications you should never mix with alcohol, and the terrifying truth your doctor probably hasn't told you. What if that evening glass of wine or weekend beer is quietly turning your prescription into a weapon against your own body? Sound impossible? But hidden inside millions of medicine cabinets across America is a silent epidemic that's sending thousands of seniors to emergency rooms every single year. We're talking about alcohol medication interactions that can cause internal bleeding, respiratory failure, and even death within hours. Here's the shocking part. Studies now reveal that up to 38% of seniors who drink alcohol are simultaneously taking medications that create dangerous, potentially fatal interactions. That's more than 1 in 3 older adults unknowingly playing Russian roulette with their health every time they take a sip. And the most terrifying aspect? 99% of people over 65 have absolutely no idea which medications turn deadly when mixed with even small amounts of alcohol. One recent case study published in Emergency Medicine described a 72-year-old woman who suffered a life-threatening brain hemorrhage just 3 hours after having 2 glasses of wine at her granddaughter's wedding. She had been taking the same blood thinner for years without problems. But that night, alcohol transformed her life-saving medication into something that nearly killed her. She survived, but thousands of others aren't so lucky. The numbers are staggering and getting worse. Research from the National Institute on Aging found that seniors are taking an average of 10 prescription medications daily. 10. Each one represents a potential interaction with alcohol that could trigger bleeding, organ failure, or catastrophic side effects. Yet most doctors spend less than 30 seconds discussing alcohol use during routine appointments. Before we reveal these 4 deadly combinations, let us know in the comments below where you're watching from, your age, and do you currently take any prescription medications while occasionally drinking alcohol? We're reading and replying to every single comment with personalized safety tips and advice. And don't forget to like this video and subscribe to our channel for more life-saving health information like this. Now, without any further delay, let's talk about the 4 medications that become silent killers when mixed with alcohol, what makes them so dangerous, and the warning signs that could mean the difference between life and death. Number 4, blood thinners. They might be the most deceptive killers on this list because the interaction seems so harmless at first. Blood thinners like warfarin, also known as Coumadin, are prescribed to millions of seniors to prevent strokes and heart attacks. They work by reducing your blood's ability to clot, which sounds beneficial until alcohol enters the picture. Here's what happens inside your body that most people never understand. When you drink alcohol while taking blood thinners, you're essentially creating a perfect storm in your bloodstream. Alcohol interferes with your liver's ability to process warfarin properly, causing unpredictable spikes in the medication's blood-thinning effects. Your INR levels, which measure how long it takes your blood to clot, can skyrocket without warning. What should be a controlled therapeutic effect becomes a runaway train heading toward internal bleeding. The danger isn't just from heavy drinking. Even 1 or 2 drinks can trigger this deadly cascade. Research published in the American Journal of Medicine found that seniors who consumed just 2 alcoholic beverages while on warfarin had bleeding episodes requiring emergency medical care at rates 5 times higher than those who abstained completely. Let me tell you about Margaret, a 76-year-old retired teacher who loved her evening wine ritual. She'd been taking warfarin for atrial fibrillation for 3 years without issues. Her doctor had told her moderate drinking was fine, but one Friday evening, after sharing a bottle of wine with her sister during dinner, she began experiencing severe abdominal pain around midnight. By morning, she was vomiting blood and her skin had turned pale and clammy. At the emergency room, doctors discovered she was bleeding internally from her stomach lining. Her INR levels were dangerously elevated, meaning her blood had essentially lost its ability to clot properly. She required emergency blood transfusions and spent 8 days in intensive care. The wine had turned her life-saving heart medication into something that nearly killed her. But internal bleeding isn't always dramatic or obvious. Many seniors experience what doctors call silent bleeding, where blood slowly leaks into the digestive tract or other organs without immediate symptoms. By the time weakness, dizziness, or fatigue appear, significant blood loss has already occurred. Warning signs include any unexplained bruising, especially large bruises from minor bumps, dark tarry stools that look almost black, blood in urine that appears pink or red, severe headaches that come on suddenly, nausea and vomiting, especially if there's any blood present, and unusual weakness or dizziness that doesn't improve with rest. The timing of alcohol consumption matters more than most people realize. Chronic alcohol use can actually decrease warfarin's effectiveness by depleting vitamin K stores in your body. But acute drinking, even just one evening, can dramatically increase the blood thinning effect. This creates an unpredictable roller coaster, where your medication's effectiveness changes based on your drinking patterns. For seniors, this unpredictability is particularly dangerous because age-related changes in liver function make these interactions even more severe and longer lasting than in younger adults. Your body simply cannot process and eliminate both substances as efficiently as it once could. Number 3. Anti-anxiety medications. Benzodiazepines represent one of the most prescribed medication classes for seniors, and when mixed with alcohol, they become incredibly lethal. We're talking about medications like Xanax, Valium, Ativan, and Klonopin. Drugs that millions of older adults rely on for anxiety, sleep disorders, and panic attacks. Here's the terrifying science behind what happens when you mix these medications with alcohol. Both substances work on the same brain system called GABA receptors, which control your central nervous system functions like breathing and heart rate. When combined, they don't just add their effects together. They multiply them in what scientists call a synergistic interaction. This means 1 plus 1 doesn't equal 2. It equals 5 or even 10 times the expected effect. The most immediate danger is respiratory depression. Your brain simply stops sending proper signals to your lungs and heart. Breathing becomes shallow, irregular, and can stop completely. This can happen within minutes of consumption, and it's often irreversible without immediate medical intervention. But the danger goes far beyond breathing problems. The combination creates severe cognitive impairment that can last for days. Seniors become disoriented, lose their balance, and make dangerous decisions without realizing their judgment is compromised. Falls become almost inevitable, and for older adults with brittle bones, a fall can mean hip fractures, head injuries, or death. Take the case of Robert, a 71-year-old retired accountant who had been prescribed Ativan for anxiety after his wife's death. His doctor had warned him about not driving while taking the medication, but no one mentioned alcohol. 3 months later, at his nephew's birthday party, he had 2 beers over the course of 4 hours. He felt fine, even drove himself home. But security cameras at his apartment complex showed him stumbling in the parking lot, falling twice, and taking nearly 10 minutes to unlock his front door. The next morning, he had no memory of the drive home or the falls. He'd developed what doctors call anterograde amnesia, where new memories simply cannot form. For 12 hours, his brain had essentially shut down its recording function while his body moved through dangerous situations on autopilot. The amnesia effect is particularly sinister because it removes the person's ability to recognize they're impaired. They may drive, make important decisions, or put themselves in dangerous situations without any awareness of their compromised state. Family members often don't realize anything is wrong until much later, when the person has no recollection of entire conversations or events. For seniors, taking benzodiazepines, even small amounts of alcohol can trigger these effects. The medications stay in older adult systems much longer than in younger people due to slower metabolism and changes in body composition. Some benzodiazepines can remain active in the body for up to 72 hours, meaning the danger window extends far beyond the actual drinking episode. The interaction also increases the risk of what doctors call paradoxical reactions, where the medication causes the opposite of its intended effect. Instead of reducing anxiety, the combination with alcohol can trigger severe agitation, aggression, and panic attacks that are far worse than the original symptoms. Warning signs include excessive drowsiness that comes on suddenly, confusion or disorientation, especially about time or location, difficulty speaking or slurred speech, problems with coordination or balance, memory gaps or inability to recall recent events, and, most critically, slow or irregular breathing that requires immediate emergency care. Number 2, over-the-counter pain relievers. This might shock you the most because we're talking about medications sitting in nearly every senior's medicine cabinet right now. Ibuprofen, naproxen, and even daily low-dose aspirin. These seem harmless, right? You can buy them at any grocery store without a prescription. But when combined with alcohol, they transform into silent destroyers of your digestive system. Here's what most seniors don't understand about this deadly combination. Both alcohol and these medications, called NSAIDs, attack your stomach lining through completely different mechanisms. But when used together, they create what researchers call a multiplicative effect. The damage isn't just doubled, it's amplified by 10 times or more. NSAIDs work by blocking enzymes that produce protective mucus in your stomach. This mucus is your body's natural shield against the powerful acid your stomach produces to digest food. Meanwhile, alcohol directly irritates and inflames the stomach lining while reducing blood flow to these tissues. When combined, you're essentially stripping away your stomach's defenses while simultaneously launching a chemical assault on the exposed tissue. The result is catastrophic internal bleeding that can begin within hours and progress rapidly to life-threatening blood loss. Unlike the gradual bleeding from blood thinners, NSAID alcohol interactions can cause sudden, massive hemorrhages that overwhelm the body's ability to cope. Research published in the American Journal of Gastroenterology found that seniors who consumed just one alcoholic drink while taking ibuprofen had a 37% increased risk of upper gastrointestinal bleeding. But here's the truly terrifying part. Those who drank more than 3 drinks per week while using NSAIDs had bleeding rates that were 2.8 times higher than non-drinkers. We saw this devastation firsthand with Eleanor, a 69-year-old grandmother, who had been taking ibuprofen daily for arthritis pain. She was careful about her dosing, never exceeding the recommended amount. But during her daughter's wedding weekend, she enjoyed champagne at the rehearsal dinner and wine at the reception. Nothing excessive, just celebrating with family. 2 days later, she woke up feeling dizzy and nauseous. By afternoon, she was vomiting what looked like coffee grounds, which is actually partially digested blood. At the emergency room, doctors found she had developed multiple bleeding ulcers in her stomach. Her hemoglobin levels had dropped so low that her organs weren't getting enough oxygen. She required emergency surgery and 4 units of blood transfusions. The most insidious aspect of this interaction is that the damage accumulates silently. Each time you combine even small amounts of alcohol with NSAIDs, you're creating microscopic erosions in your stomach lining. These tiny wounds don't heal properly when the damaging cycle continues, eventually becoming ulcers that can perforate and cause internal bleeding. For seniors taking daily low-dose aspirin for heart protection, this becomes particularly complex. Many cardiologists prescribe 81 milligrams of aspirin daily to prevent heart attacks and strokes. But even these tiny doses can cause significant bleeding when combined with alcohol. The protective benefit for your heart may be completely negated by the bleeding risk in your digestive system. Warning signs include severe stomach pain that feels like burning or gnawing, black tarry stools that indicate bleeding in the upper digestive tract, vomiting that contains blood or looks like coffee grounds, sudden weakness or fainting spells, pale skin, or feeling short of breath during normal activities. These symptoms require immediate emergency medical attention because internal bleeding can become fatal within hours. Number 1. Antidepressants. The most prescribed class of medications for seniors, and potentially the most dangerous when mixed with alcohol. We're talking about SSRIs like Zoloft, Prozac, Lexapro, and Paxil, medications that millions of older adults depend on for depression, anxiety, and other mental health conditions. The interaction between alcohol and antidepressants creates a perfect storm in your brain that can trigger a life-threatening condition called serotonin syndrome. Both substances affect serotonin levels, but in unpredictable ways that can cause your brain chemistry to spiral completely out of control. Here's the deadly science. SSRIs work by increasing serotonin availability in your brain, which helps regulate mood, sleep, and anxiety. But alcohol also causes temporary spikes in serotonin production, while simultaneously disrupting other neurotransmitters like dopamine and glutamate. When combined, your brain can be flooded with dangerously high levels of serotonin that trigger severe physical and neurological symptoms. Serotonin syndrome can develop within hours and progress rapidly to coma or death. Early symptoms include severe agitation, confusion, rapid heart rate, high blood pressure, excessive sweating, and muscle rigidity. As the condition worsens, patients can develop seizures, extremely high fever, and complete cardiovascular collapse. But even without reaching full serotonin syndrome, the combination creates dangerous cognitive and physical impairment. Alcohol amplifies the sedating effects of antidepressants while reducing their therapeutic benefits for depression and anxiety. This creates a vicious cycle where people feel worse emotionally and may increase either their drinking or medication use, making the interaction even more dangerous. The case of James, a 73-year-old widower, illustrates this perfectly. He'd been prescribed Zoloft after losing his wife and was responding well to treatment. But during the holidays, feeling lonely and nostalgic, he began having wine with dinner more frequently. Within weeks, his depression symptoms returned with a vengeance, but now accompanied by severe confusion and memory problems. One evening, after having 2 glasses of wine with his medication, he became severely agitated and disoriented. His neighbor found him wandering outside in his pajamas at 2 a.m., unable to remember his address or recognize where he was. At the hospital, his heart rate was dangerously elevated and his blood pressure had spiked to stroke levels. He developed early serotonin syndrome that could have been fatal without immediate treatment. For seniors, this interaction is particularly dangerous because age-related changes in brain chemistry make them more susceptible to serotonin fluctuations. The blood-brain barrier becomes more permeable with age, allowing substances to affect brain function more readily and unpredictably. The interaction also dramatically increases suicide risk, which is already elevated in older adults dealing with depression. Alcohol removes inhibitions, while antidepressants can initially cause increased suicidal thoughts in some patients. The combination creates a perfect storm where impaired judgment meets increased suicidal ideation, often with tragic results. Warning signs include sudden mood changes or increased depression despite medication, severe agitation or restlessness that's unusual for the person, confusion or memory problems that develop rapidly, excessive sweating or fever without other illness, muscle stiffness or tremors, rapid heart rate or changes in blood pressure. Any of these symptoms combined with alcohol and antidepressant use requires immediate emergency medical care. The truth about alcohol and medication interactions isn't just about avoiding obvious combinations. It's about understanding that your aging body processes both substances differently than it did when you were younger. Your liver works more slowly, your kidneys filter less efficiently, and your brain becomes more sensitive to chemical changes. Every medication in your cabinet has the potential to interact with alcohol in ways that could be life-threatening. The safest approach is simple. If you're taking any prescription medication, especially these 4 categories we've discussed, alcohol should be completely eliminated from your routine. Your health, your independence, and your life are too precious to risk on that evening cocktail or weekend beer. These aren't just numbers in a research study. These are real people, real families, and real tragedies that happen every single day across America. Now we want to hear from you. Have you or someone you love ever experienced unexpected side effects after mixing alcohol with medication? What happened? Share your experiences in the comments below. Your story could save someone's life. Thanks for watching, and remember, when it comes to mixing alcohol with medications, the only safe amount is 0.